The question for today is a 30-year-old female presented with the following features. Muscle biopsy was performed. What could be a possible diagnosis? So here it's a middle-aged female who is showing these features, and what finding amongst these can you expect in the muscle biopsy is the question. So what is this feature which is shown here? In the hands you have some erythematous scaly lesions. This we call it as Gottron's papules. Okay, here the next image shown is a lilac colored discoloration around rash around the eyes in the periorbital region. This we call it as heliotrope rash. I hope now you can guess what's the diagnosis. So you have heliotrope rash and Gottron's papules in a young female. So that points to the diagnosis of a condition called dermatomyositis. So as the name goes, you have dermatological manifestation plus myositis. Okay. So in a muscle biopsy, what do you see in this condition? Okay. So this is a very important question, and dermatomyositis is always asked in exams. So look at this image. This is a muscle biopsy. So this is a fascicle of a muscle. So all these are muscle, usually has a nucleus in the subsarcolemmal position. So when you see it at the end, the muscle fibers are very small. Okay, so this is the normal size, whereas at the edges it is atrophied. So this is called perifascicular atrophy. So perifascicular atrophy is seen in case of dermatomyositis. Okay. So now let's go to the question. So the answer here is perifascicular atrophy. So what about the other options? So other option was ragged red fibers. What do you mean by ragged red fibers? So this again is an important question. So when you take a muscle biopsy in case of mitochondrial myopathies. So have you heard about mitochondrial myopathies? So what are the diseases under this category? So you can have a lot of disease. So your skeletal muscle has got a lot of mitochondria. So this disease usually affects the cells which are rich in mitochondria. So because it's affecting the muscle, you will have myopathic features. It can affect your ocular muscles, extraocular muscles. You get ophthalmoplegia. So you have a lot of diseases like MRF, which is mitochondrial encephalopathy with ragged red fibers. MELAS, mitochondrial encephalopathy, lactic acidosis and stroke-like episodes. Then your Kearns-Sayre disease. Like that you can have a lot of disease. Okay. So what happens when you take a muscle biopsy in case of mitochondrial myopathies? So these mitochondria are abnormal. They lack certain enzymes. Okay. So in that condition, these mitochondria will accumulate in the subsarcolemmal position. All these are some special stains. This is a Gomori's trichrome. Okay. So in this special stain, it's highlighting all these abnormal mitochondria. So this we call it as a ragged red fibers. So ragged red fibers are seen in mitochondrial myopathies. Okay. Next option was rimmed vacuoles. So what do you mean by rimmed vacuoles? So the image shown here is showing some vacuoles in the muscle. So this we call it as a rimmed vacuoles. So rimmed vacuoles is seen in a condition called inclusion body myositis, which is a type of inflammatory myositis. Okay. So rimmed vacuoles is seen in inclusion body myositis. Ragged red fibers is seen in case of mitochondrial myopathies. Okay. Thank you.